Brain stroke is a devastating disease, my friends. If it kills someone on the spot, there is absolutely no more suffering. But if someone survives a stroke, chances are that he or she will be disabled, maybe for life, maybe mild, maybe severe. Every year, about 2 million Indians suffer a brain stroke, and this number is about 1/5 of the global stroke burden. Stroke is increasing in incidence every year in India, and the numbers are going up rapidly like a new pandemic. You can say India is not too far from becoming the stroke capital of the world. I wanted to make a video on stroke prevention. Many of my patients and their families wanted this one, and here is the result, friends. Hope you like it. Hello and welcome. This is Dr. Arun Naik from DocLogs channel, helping you to have dialogues with your doctor. I am a neurosurgeon and a health blogger. If you are new to the channel, please consider hitting that subscribe button. All additional info, tips, tricks told in this video, I will leave the details in the description box below. If you want, you can check those out. That said, let's have a doclog. What can you do to prevent a brain stroke? Of course, age makes us more prone to having a stroke. Also, having a mother, father, or any other close relative who has had a stroke also increases your risk of developing one. You can't reverse the age or change your family history, but there are many other stroke risk factors that you can control if you are aware of them. Knowledge is the new power, friends. Let's have this knowledge of prevention of stroke in this video, because 80% of these strokes could be prevented. Number one, control blood pressure. High blood pressure is a big killer, friends. Doubling or even quadrupling your stroke risk if it is not under control. High blood pressure is the biggest risk factor for stroke, both in men and women. High BP damages your wall of the arteries, weakening them. Eventually, weakened arteries are lined by blood clots or fat cells, ultimately clogging that artery. Other than this, high blood pressure can rupture a brain artery and cause that hemorrhagic brain stroke or brain hemorrhage. Either way, it is wise to monitor blood pressure, and if it is uncontrolled, treating it. It is probably the biggest help people can make to their vascular health. I always tell my patients to maintain a blood pressure of around 120/80 if possible. How to achieve it? Friends, reduce the salt in your diet. Ideally, no more than 1.5 grams, that's about half a teaspoon of salt per day. Get more of exercises, at least 30 minutes of activity a day and more if possible. Number two, lose weight. Obesity, as well as the complications associated with that, including the high blood pressure and diabetes, raises your odds of having a stroke. If you're overweight, consider losing as little as 5 kgs, and it can have a real impact on your stroke risk. Your goal should be a body mass index BMI of 25 or less, but that may not be realistic for you. Consult your doctor and dietitian to customize a personal weight loss strategy. How to achieve it? Try to eat no more than 1500 to 2000 kilocalories a day, of course depending on your activity level and your current BMI. Increase the amount of exercise you do with activities like walking, running, gymming, golfing, or playing tennis, and make that activity a part of every single day. A simple practice of avoiding elevators gives you enough exercises for your needs. Number 3, control sugar. Having high blood sugar damages the blood vessels over time, making clots more likely to form inside the brain arteries. Avoid simple carbs because eating too much of simple sugars immediately elevates your blood sugar, and that elevates your insulin levels also. High insulin levels, friends, are the new villain. High insulin levels are shown to be more pro-inflammatory and cause vascular damage and ultimately lead to heart attack and brain stroke. Your goal should be to keep your blood sugar under control. Now, how to achieve it? Monitor your blood sugar as directed by your doctor. Use diet, exercise, and medicines to keep your blood sugar within the accepted range. Number 4, moderate your alcohol intake. Drinking a little alcohol is okay, and it may actually decrease your risk of stroke. I am not saying this. Studies show that if you have about 1 drink per day, your risk may be slightly lower. This is a fact open in the public domain, and please do not start drinking to prevent just the stroke. If you're a drinker, once you start drinking more than 2 drinks per day, your stroke risk also goes up very sharply. Your goal should be don't drink alcohol if you don't, or do it in moderation if you do. How to achieve it? Have no more than 1 glass of alcohol a day. Make red wine your first choice because it contains resveratrol, which is thought to protect the heart and brain. Watch your peg sizes, friends. A standard sized drink is about 5 ounce glass of wine, 12 ounce of beer, or 1.5 ounce glass of hard liquor. Watch my video on how alcohol affects your brain. Link is somewhere here. Let's go to the next. That is tip number 5. Treat atrial fibrillation. Atrial fibrillation is a heart disease with irregular heartbeat that causes clots to form inside the chambers of the heart, and these clots can then travel to the brain, producing a stroke. Atrial fibrillation carries almost a 5-fold risk of stroke. Your goal should be, if you have atrial fibrillation, get it treated. If you have symptoms such as heart palpitations or shortness of breath, see your doctor for an exam. You may need to take an anticoagulant drug like blood thinner to reduce your stroke risk from atrial fibrillation. Your doctors can guide you through all this process. Let's go to tip number 6. Quit smoking. Smoking causes clot formation in a couple of different ways. It thickens your blood and it increases the amount of plaque buildup in the arteries. Kicking that butt is one of the most important lifestyle changes that will help you reduce your stroke risk significantly, and yes, that lung cancer risk too. Ask your doctor for advice on the most appropriate way for you to quit. Don't quit abruptly because it leads to withdrawal syndrome. Use quit smoking aids such as nicotine pills or patches, counseling or medicine. Don't give up. Most smokers need several tries to quit. See each attempt as bringing you one step closer to successfully beating the habit. Good news is that, friends, after 2 years of stopping smoking, your risk of stroke comes down similar to a non-smoker. Let's go to next factor. Number 7, exercise. Shortcut way to reduce your heart attack and brain stroke risk. That's the reason why we call it a cardio. It's an aerobic exercise. Brisk walking, running, swimming, cycling, playing tennis, and jumping rope. All these are cardio exercises. We recommend at least 150 minutes per week. That is 30 minutes at least 5 days a week. Aerobic exercise improves circulation, which results in lowered blood pressure and heart rate. Aerobic exercise also reduces the risk of type 2 diabetes, and if you already live with diabetes, it helps you control your blood sugar. Second type of exercise is resistance training. Resistance training, friends, has a more specific effect on body composition. For people who are carrying a lot of body fat, including belly fat, it can help reduce fat and create leaner muscle mass. Research shows that a combination of aerobic exercise and resistance training may help raise HDL, that is good cholesterol, and lower LDL, that is bad cholesterol. How much? At least 2 non-consecutive days per week of resistance training is a good rule of the thumb. You can work out with free weights such as hand weights, dumbbells or barbells. Let's go to the next tip. Tip number 8, eat healthy. Eating healthy is one of the best strategies. How much you eat is just as important as what you eat. Use a small plate or bowl to help control your portions. Eat more of low-calorie, nutrient-rich foods such as fruits and vegetables. Eat less of high-calorie, high-sodium foods such as refined, processed or fast foods. Vegetables and fruits are good sources of vitamins and minerals, are also low in calories and are rich in dietary fiber. Eating more fruits and vegetables may help you cut back on your higher caloric foods such as meat, cheese and snack foods. Avoid refined grain products. Whole grains are good sources of fiber and other nutrients. Try a new whole grain such as whole grain farro, quinoa or barley. Avoid saturated fats like butter, ghee, coconut oil and palm oil. Cakes, biscuits, fatty cuts of meat, bacon, cheese. These contain more of LDL or bad cholesterol and is dangerous for your heart and brain health. Choose those monounsaturated fats such as olive oil or canola oil. Polyunsaturated fats found in certain fish, avocados, nuts and seeds also are good choices for a heart healthy diet. Watch a video on my channel to more about this cholesterol foods. Link is somewhere here. Let's go to the next tip. Tip number 9, stress-free life. Everyone has mental stress. Having too much stress for too long is bad for your heart and brain. It raises your blood pressure and it's not good for your body to constantly be exposed to stress hormones. Studies have shown that stress changes the way blood clots, which makes a brain stroke more likely. The way you handle stress also matters. If you respond it to in unhealthy ways such as smoking or overeating or not exercising, that makes matters even worse. On the other hand, if you exercise, connect with people, socialize, that makes a difference in your emotions and in your body. Let's go to the last tip. Tip number 10, regular health checks. Probably the top tip, I kept it in the last to prevent stroke. Discovering potentially life-threatening health issues early before they cause a brain stroke is priceless. Regular monitoring of existing health issues, if any, will lower the risk of worsening. General guidelines say that before the age of 50, you should get your health check done once in 2 years and after that once a year. And if you are already having a health issues, then this rule doesn't apply. You may need yearly checks. Among my top tips, this one definitely tops the list. I practice and preach yearly checkups for all my patients because, as they say, prevention is better than cure when it comes to chronic life-threatening diseases. With that, friends, we have come to the end of this video. Thanks for watching and hope you found this video helpful. If you liked it, give me a big thumbs up. Share this video with your dear and near ones to put them also on the positive side of their health. If you're new here, please consider hitting that subscribe button. Hit that bell icon to get instant notifications of my new videos. Friends, if you had a friend or a family member was affected by a stroke, let us know what was the risk factor. Go ahead and drop your thoughts in the comment section below. Let's discuss this further. Till my next one, feel awesome, live awesome, and take good care of your health.